You're in a rural village in the Eastern Cape. Long dirt roads, no nearby clinics or ambulances in sight. Now imagine you hear this tiny sound coming over the hill. And that sound, that is what the government says is coming to save your life. Not a paramedic van, not a 4x4 emergency vehicle, a motorbike with a coffin-sized trailer attached to it. And the province has paid millions for them. What exactly happened with the Eastern Cape scooter ambulances? A healthcare innovation for rural communities, or one of South Africa's greatest examples of you cannot be serious? Wait, what happened? In June 2020, right in the middle of COVID-19, the Eastern Cape Department of Health unveiled a brand new medical initiative. Officials called it groundbreaking. It was a solution for villages where ambulances can't reach, a plan to save lives on treacherous roads. But within hours of the launch, South Africans were asking, is this a joke? Because what the department had presented were motorbikes fitted with a small patient capsule that looked more like a tourist tuk-tuk than an emergency medical solution. The story went viral. People were furious. Accusations were all over the place. It was corruption, incompetence, tender irregularities. Oh, this is just photo ops, and a total lack of medical safety protocols. So today we're unpacking what we know for sure, what remains disputed, and why the scooter ambulances remain one of the most controversial health projects in this province's history. In June 2020, the Eastern Cape Health Department unveiled 100 motorcycle medical scooters. The department publicly stated that they cost 10 million rand. The official purpose being to reach remote areas, to transport patients, deliver medicine, and to support community health workers. The scooters were standard motorcycles fitted with a small trailer that was called a sidecar clinic, a stretcher compartment, and a medical storage box. They were not registered as emergency vehicles, and they were not approved by national EMS protocols. Emergency medicine specialists raised concerns. They said the trailers were not vibration safe for patients. They said there were no oxygen mounts, no shock absorption, there was insufficient space for medical assistance, and that these were unsafe for transporting pregnant or trauma patients. The South African Human Rights Commission found that the scooters didn't comply with the National Health Act's emergency care standards. The Commission also highlighted that there were tender irregularities and procurement concerns. In the end, the scooters were never rolled out as ambulances. Most of them ended up standing unused in storage. The project faced internal investigations and lots of public scrutiny. From verified reports and government documents, this is where things fell apart. These were marked as ambulances, but they were not ambulances. They didn't meet the national emergency medical standards. EMS unions and medical experts were not consulted. Procurement raised many red flags, from pricing to supplier selection. The public outrage also forced the department to pause the rollout. The investigations also later confirmed that the project was not fit for purpose. So what was it really? Was it corruption, or was it incompetence? Was it a genuine idea just executed terribly? Here's what we can say for sure. The project failed, money was definitely wasted, and the scooters never delivered on the promised service. And no one has been held fully accountable. Some have suggested that it was a well-intentioned idea, just launched in the worst possible way. But years later, the fact remains that the people who needed the help never got it, and they are still waiting.